Hi, I'm Colin Stevenson. I'm the Vice President of Operations for Colchester East Hants Health Authority. We're here today to take you through a tour of the new Colchester East Hants Health Centre. What we'll be doing is walking through different sections of the building, giving you a sense of the layout, the relationships between the different departments, and how far along we are in construction. So the main activity right now is mechanical and electrical work going on above the ceiling and behind the walls, and then the drywall going up to close in those areas. So you'll be seeing different levels of development as we go through the facility. Some areas just starting to get stud and drywall going up, and other areas where it's completely closed in and we're actually starting to prime the walls.
So things are being placed, services are being placed in the new hospital to make things run more smoothly, more of a connection.
Right. So in the programming stages of this, there was a lot of work done on the relationships between services. So, you know, what's the most efficient location of each service as it relates to those that they use the most. So diagnostic imaging here in the middle of the building, so it has access to patients from an outpatient perspective. Right on the other side of it is the emergency department. So if somebody's coming in, requires an emergency x-ray of some sort, they just basically cut across the hallway with that patient and they're immediately in the diagnostic imaging department. So the same thing of looking at, okay, so emergency needs to be on the main floor, access, easy access to the road for ambulance, close to DI, what other services need to be near that. So right above it is the ICU and the surgery unit. So they have here, which is a patient elevator bank, which will be used by staff if they need to move patients from floor to floor. So really trying to get the best relationship between services, where it's horizontal, so next to each other, or vertical, one on top of each other. So just to give you a sense of where we are and the relationship between services. So starting at this corner, going out to the edge of the building is all of the emergency department. And the design here is a little bit different than what we've had in the past. It is considered more of a racetrack. So all the services, in the sense that patients are on the inside, and there's a corridor that goes all the way around. So patients can be brought down and brought into a room or a door on the outside of the room, and then the staff have access to the patient rooms from the inside. So it's a bit of a sort of a semi-sterile corridor in that sense. There'll be nursing stations all the way down through the middle, so small working stations where they have access and visibility to the patient rooms that are around that desk. So as opposed to one central nursing station and then rooms spread out, this is a long sort of corridor down through the middle with separated nursing stations or desks, and where they have better visibility to rooms all along that. And then if patients are coming in and being seen here and require x-ray, then they're just brought out into this corridor and straight across the hallway into the back part here, which is diagnostic imaging. So really nice proximity to that service, which we know emergency department staff and patients are very dependent on. So how this was built as well is that it has the ability to, you expand further back into the department depending on the volume of patients. So this is almost sort of a separation corridor, so it's a cross corridor, which allows people to sort of move through the department or for servicing. But also, you can close off this back part of the emergency department and just be using the front end. So this is that center core part. So you can see that there's access to rooms on either side, and the nursing station or the workstations are going to be all the way down through this center core. So now we're in the main floor of the ambulatory building, which is at the front of the health center. And one of the things that we wanted to make sure that we did is had access to sunlight even when you're in the back of that section or the middle of the building. So within this area we'll have our medical day, and some of our outpatient clinics and our oncology or chemo patients will be coming for treatment. So any of the cancer care services that we provide. So even though those services are located in the midst of a building or in the middle of the building, there's still access to views outside into daylight for services and for those patients. So right now we're standing in the entrance to the staff and the service entrance really to the labor and delivery department, or the obstetrics program. And it's located just off of or next to the operating suite for the facility, which is in the middle building. We just left that area. So when we looked at proximity of services, the labor and delivery and the maternal child program is closer to the surgical suite than the surgical inpatient. And the reason being is that most patients who come for inpatient surgery are scheduled, or the patients that are there for recovery purposes post-surgery. So it could be somebody who came in through the emergency department. So we looked at the likelihood of somebody who's in distress and needs to get quickly to the surgical suite from an inpatient perspective, And where there's the greatest risk is the mother that's in delivery and has requires assistance that requires them to go to the operating room. So how we're set up now is that we have what's called a labor, birth, recovery, and postpartum unit, which will be in this new hospital. It's a service that it's not how we do it currently. And what will happen is that they'll go there for delivery. If it's normal, then they'll deliver and recover within that unit. If there is an issue, then they will actually be taken out of that room, straight across the hallway, and right through double doors into the operating suite. So real close proximity and a really quick response time for the staff to be able to get that patient over into the surgical suite. This is another one of the gardens that's being done within the facility. So this is for access to the inpatient mental health unit, which has a door that comes into this, and it's a secure garden area. We've had 2 gardens done so far with a partnership with the Agricultural College. So a professor there and one of her classes came over and have done the setup, picked the plants and did the planting for this garden, and they're going to be doing 4 more gardens over the next year and a half.
And there's a certain level of privacy in this particular garden.
There is. There's a certain level of privacy. There is, obviously there's open windows as you go up and further up in the building, but right now these windows are tinted so that there is some privacy for patients that are treated.
And do the gardens serve almost as a way to help patients with?
Yeah. So there's been a lot of work done even within our mental health program and staff and research they've done, and also things that were decided during the design stage of the project to look at how you create a healing environment. And it's not just the medical delivery of the services, but it's also the access to sunlight, access to green space for our patients, so that they can come outside, see that from their windows, and our understanding and belief is that will create a better healing environment.